that is the problem. Too many people in our community, right, men and women, right, think of themselves as a colored woman or a colored man rather than a woman or a man. I think that's powerful. Right. And I'm going to play that forever. You know, you get people, Doc, and we're going to have the doctors speaking this evening, if I may call them doctors, about sickle cell and diabetes.
Sure.
But, you know, we have people in positions in our community. You know, it was funny, Doc. It's a lady at Department of Children Health and Social Services. You know, you got people in place in some of the school districts where they can not give us anything, but give us a handout. And they would do everything to block black folks in our community. And then they run around hollering kumbaya and black power and we shall overcome. And until some of these folks move out of the way and let some of the different minds, you know, like how you and I talk about our kids, our children, you know, that is the future. And you know, to be perfectly honest, some of these folks, that's what they think of themselves as color folks, rather than just human, just as people. So that was so powerful. And you know, Sidney Poitier did that movie like 30 years ago. Guess Who's Coming to Dinner? You know, but it was so powerful. And Alvin, thank you. I mean, the way you put that together, that was powerful. So I'm gonna play that forever and ever. Ladies and gentlemen, gosh, that was nice, man. I like that.
I like Sidney Poitier.
I like Sidney Poitier too. Sidney Poitier said, look, he's doing the movies, right? Remember the movies like back in the day, like the white person was smacking him? He's like, look, if you smack me, I'm smacking you back. I ain't going for that. Okay, this is what we have, Doc, I'm gonna let you guys kind of roll with it. This has always been like one of our more popular segments when we talk about health. If you have questions about sickle cell or diabetes, we want to kind of keep it narrow. But if someone has a question, Doc, I don't know how to move on. So you guys could kind of take it from there, whichever way we want to go.
Sure. Good evening. I'm Dr. Senyok. I'm a family physician in Wilmington. And with me today is Dr. Anderson, Nina. She's also, she's a nurse practitioner actually. And she had a PhD from Jefferson. So Nina will, you know, sickle cell is a very, very important medical condition. And Nina actually is an expert in that disease.
You know, when we talk about sickle cell, I remember doing Christmas drives for children with sickle cell. And sickle cell, it pretty much affects our community a lot, right? Especially minority community. And people don't live long, right? Sometimes they die at a young age with sickle cell. Mm-hmm. Am I wrong? All right?
No.
Well, explain to me what sickle cell is.
Sickle cell is an inherited blood disorder that affects the blood cell's ability to carry oxygen and nutrients to the blood cells. Because of the blood cells being abnormally shaped, what happens is under certain conditions, they clump up and they clog in the blood vessels. And when the body is not getting enough oxygen and nutrients to the organs, the tissues, or bones, that causes excruciating pain and also complications. But sickle cell patients are living longer lives. In fact, Dr. Shinoki, I saw one of his patients 2 weeks ago that was 70.
Oh, wow.
Living with sickle cell anemia.
Well, is that new? Because I thought, have they always lived a long, prosperous life?
They've been always I would say within the last 10 to 20 years, you know, the medical community had told a lot of young adults and adults now that they wouldn't live to be 18. Mm-hmm. But there's been a lot of advancements in research and treatment options for them that have increased their life expectancy tremendously.
Now, one of the things that used to happen is that people used to have infections, people used to have strokes and things like that. And
based on sickle cell?
From sickle cell, and we do things now to prevent that from happening. For instance, we will give people pneumococcal vaccine, mm-hmm. which will prevent pneumococcal infections, which used to be a big killer. Mm-hmm. And you know, I would say 10, 15 years ago, people used to be, you know, people die in their 40s. Mm-hmm. Now people can live up to 70 years.
Is sickle cell hereditary, or is it something that you can catch?
It's hereditary. Both parents either have to carry the trait, or one parent have the disease and the other have the trait. So it's in a genetic inherited condition that you get from your parents.
How do you know if you have sickle cell?
Started in 1990. Most of the states enacted a newborn screening program. So every baby that's born, at least in the state of Delaware and about 48 other states, are tested at birth. So within probably a week or two after the baby's born, they will get a call if their baby has sickle cell anemia.
Is there any preventive measures? I mean, or is it just what you?
Yeah.
What are some of the things that you can do once you have it? I mean, do you like work out, or is it just all medicine?
I think that it needs to be a combination approach. Obviously, when the baby's born, you want to get connected with a comprehensive sickle cell center, and the AI does have that. But there's medicines to help prevent infection, like amoxicillin, penicillin, getting all of your routine vaccines, and then being very conscious about fever management, as well as checking their spleen and understanding how to do that. But for the most part, what I have always tried to tell parents is that you have a healthy child with a special condition, because we don't want them to think of themselves as being different from any other child. And we have the expectation that they can do all kinds of things that any other child can do under special.
And live as long.
Yeah. So we definitely encourage them to live healthy lifestyle.
Dr. Sinyoki, talk to me a little bit about diabetes. I know we talked a little bit about this in the green room. Can you explain diabetes, or is there any preventive measures, medicines for that also?
Basically, there are two types of diabetes, type 1 and type 2. But for the most part, when we speak about diabetes, we are talking about type 2. And as you can imagine, there is more and more people being diagnosed now with type 2 diabetes. And the reason is frankly because of our lifestyle, the kind of foods we eat, lack of exercise, and things like that. Plus also additionally, we now have better tools to make the diagnosis. The whole goal is for one to make the diagnosis and try to prevent that, from happening. We know that by the time we make the diagnosis, the process has been going on for the past 5 years. So if somebody has all of the signs and symptoms, the family history, and if you look at their BMI, they are overweight, you need to begin the process of talking to them to say, look, you need to change your lifestyle, you need to exercise, you need to eat a heart healthy diet, you need to have a relationship with your physician. Certainly, you don't smoke. And all of these things will prevent, hopefully, diabetes.
Is it pretty much overweight? Is it pretty much a dietary thing?
Not completely, but it's a huge factor in terms of when people are sedentary and they are overweight. They develop what we call insulin resistance, and that ultimately leads to type 2 diabetes.
It appears to me, especially in the minority community, in the black community, a lot of stuff like we're talking about is hereditary. Once like our parents from the 40s, 50s, it carries all the way up to now. So you almost got to be doubly conscious about stuff.
Yeah, well, there's some relationship between families and people who have diabetes. For instance, if your both parents have diabetes, it's likely that you also may develop diabetes. But
let me stop you there. So regardless, if you like in shape, if you work out, regardless, I mean, you can still have it.
Yes, there are different types of diabetes. There's a type of diabetes where no matter what you do, you will still have diabetes. But for the most part, a lot of people that have type 2 have done things to cause them to have diabetes, which means they don't exercise, they don't eat healthy. And I'm talking about a heart healthy diet, Mediterranean diet, for instance, lots of fruits, vegetables, nuts, extra virgin olive oil, things like that. And of course, a regular exercise is very, very crucial. And I always tell my patients, there's a couple of things you can do to prevent yourself from at a very early age. And that includes not just you, but your family also, your children. You have a situation where you drink water. Tap water is cheap. You don't have to pay for it. In fact, it's better to drink tap water than to drink bottled water. And it's healthier for you. So you drink water, you eat healthy, you exercise, you have a good relationship with your physician, and you don't smoke. So if you do those 5 things, the likelihood is that you can stave off some of these major medical illnesses that we have, diabetes being one of them.
Is there any signs, is there a sign to know you're diabetic?
Yes, there are some signs and symptoms of diabetes. Usually most people once they start having the elevated blood sugars, they'll begin to have a process where they get very thirsty, they get very hungry, they begin to urinate a lot. Sometimes they will lose weight. And those are
Lose weight?
Yes, yes. And those are signs that something is going on, and it's a good time to. And you can go to a Walgreens or Happy Harry's or one of those stores and get one of those blood sugar testing kits and just test your own sugar. And usually, if your fasting sugar, which is after you fasted for some time, is over 126, there is a problem. And we do have special tests that we do. We call it hemoglobin A1C, and usually if that is over 6.5.
And that kind of stuff, not to, I mean, I'm not medical, but just going off a little bit, does that start going into strokes and aneurysms and all that kind of stuff and heart conditions? And I mean, it just like escalates to other stuff.
Yes, one of the reasons why we are very serious about diabetes is because we want to prevent bad things from happening. And what are those bad things that happen if you have diabetes? One, you can have problems with your kidneys, because diabetes destroys the kidneys, and people end up with kidney failure and ultimately end up on dialysis. You can go blind because diabetes can destroy the retina and also the lens in the eyes. Sometimes people have heart attacks, and diabetes basically destroys the blood vessels. So you have damage to your blood vessels going to your heart that can cause heart attacks. Sometimes you have difficulty with all of the blood vessels in your extremities. People have amputations. The same thing happens to the brain. People have strokes. So the whole goal of treating diabetes is to prevent all those bad things from happening.
Okay. Hey, Alvin, if you could do me a favor and put the number up, because I have the medical personnel on. I'm sure people will have to ask some questions rather than me try to be like a doctor. I know I'm Dr. Storman. It's like Al Payne used to say, I have a PhD in poverty, hunger, and determination, but I don't think that qualifies me to answer the questions. And you wanted to make an announcement. Alvin, put the number up there for me. Did you want to make an announcement about something?
Yes, I just wanted to thank everyone who came out to our second James Fawcett III Sickle Cell Fed K1 walk, which was held on September the 14th. We were very fortunate to raise $15,000 for sickle cell awareness here in the state of Delaware. And from some of those proceeds, we wanted to help out some sickle cell families with their gas and electric bill this year. And so if you're interested and if you have sickle cell, we have a heating fund, and we're asking you to apply by December 7th and to call our office at 762-0200 to fill out an application and see what we can help out.
Okay, gotcha. Let me ask you guys another question. Do you think that, I mean, we could talk about Obamacare and all that kind of stuff too. I mean, I don't know if you want to get into that Medical Care Act. Do you think that we kind of oversubscribing now, like too many people on too many pills? I mean, I get that question a lot of times, and people are scared because it seems like it's medication for everything. And then they become an addiction for pain. So you start to take Oxycontin or another medicine.
Certainly, there are two parts to that story. For instance, if you have the kind of disease that we are talking about, diabetes, you definitely need a cocktail of medication, and you have to be on medicine to bring down your blood sugar. A lot of times you need medication to prevent your kidneys from being under stress. Those medicines are called ACE inhibitors. You should be on medicine to prevent your cholesterol from being elevated. So that's 3 right there. And for the most part, if you're a male and you're African American, you probably should be on aspirin also, and baby aspirin. So there you go, that's 4 right there. But that's different from somebody who has a condition like a back injury, a neck injury, who is taking
But do it become addictive now? I mean, some of the medicines?
No, those medicines are actually not addictive. Yeah, those medicines actually are necessary to prevent you from getting some of those complications.
Okay, how you doing? You have a medical question for the doctors?
Yes, this is Junebug. Yes, the medical doctor Bill. You know about what happened on Wednesday?
On Wednesday?
Yeah,
I don't.
Wednesday afternoon when the police got shot.
I don't know. That's a medical question. When the police got shot. What do you mean? Like, did it? Did I don't know.
It was in town.
Yeah, I don't know if we know about that. That might be a police question. How you doing? Welcome to the show. See now you're chief of police. How you doing?
Hi, Norm. I have a question for doctor and the nurse practitioner. I have diabetes type 2, and I have trouble with neuropathy, and it's very painful. I'm on gabapentin, but I find where at night especially my left foot and ankle pain me real bad, and then I have this burning sensation in my foot a lot of times. The second question is, I wasn't diagnosed with sickle cell, but I was diagnosed with, the other one, thalassemia. And I was wondering if I could get any help with answers to those questions I just asked.
Okay, hold up. Go ahead. You guys want to answer?
For the thalassemia question, it depends what type of thalassemia you have. But thalassemia is also something that you inherit from your parents. It really doesn't cause you any problems. It may make your blood cells look a little bit smaller and paler in color. The most important thing is that iron, if you have like a beta thalassemia trait, or if it's alpha thalassemia, the iron cannot bring up your blood count. And it's something that you live with, and it doesn't usually cause you any problems.
Okay. No.
Now, for the question about neuropathy, one of the problems with diabetes is that people who have diabetes may develop neuropathy, just like you described. One of the things you can do is you should continue to exercise. You should have a good relationship with your physician. Gabapentin is a good medicine to start with. If that doesn't seem to be helping, there are other medicines such as Lyrica or amitriptyline that your physician can add to help you feel better at night.
Okay, that answers your question?
But it's important for you to talk to the physician. Let them know.
Okay, thank you.
You're welcome. How you doing? Welcome to the show.
Hi, good evening, Norman. How are you?
Fine.
I listen to your show every Sunday. I wanted to find out a couple of things. I have a twin, and we both carry the muscular dystrophy gene. My twin sister's children have the sickle cell trait and the sickle cell disease, but none of my children have that. Why is that?
And do you have the sickle cell trait?
No, I don't.
And
my twin sister does.
How about your the father of your children?
No.
Okay, so there's no way that your children can have the sickle cell trait or the disease because you don't carry the sickle cell gene. It has to be passed on by one parent or both parents.
Oh, okay. Because I had some concern about that, with the connection of her children. 2 or 3 of her children does have that. One actually expired from sickle cell. So I had that bit of concern. Also, could you repeat that number again for assistance with the energy program, please?
Sure. It's 762-0200.
Thank you so much.
And you know you're a smart woman to watch this show every this Sunday. You know that?
So that would
Yes,
be
I am.
Okay.
Yeah.
How you doing? Welcome to the show.
Hello.
How you doing?
Okay. Well, not really, but I'm hanging in there. I have some questions for the doctors.
Okay. Turn your TV down a little bit so we can hear your question.
Okay. Yes, I would like to know about treatments for fibromyalgia.
Go ahead. Do you want to answer?
Sure. Fibromyalgia is a really complex medical condition, and once you are diagnosed, there are several treatments. One of the most important treatments is to have a good relationship with your physician again, to make sure that you get a physical exam on a yearly basis, to make sure that you get all of your immunizations, to make sure that you exercise, to make sure that you are not overweight. Now, there are medications that are approved for fibromyalgia, starting with amitriptyline, 10 milligrams at night. And that can go all the way up to medicine like Pristique or Savella. But we can't, because we don't know you and we are not examining you, we can't basically give you any specific answers except
You know, for folks who probably don't know exactly, what exactly is that she's talking about?
fibromyalgia.
Yeah.
It's a connective tissue disease. It's where all of your body just aches and it's very painful,
wow.
and people have a lot of discomfort, multiple parts of the body. There's some element of slight, because of there's so much pain, there's element of severe depression with it also.
Okay, thank you. How you doing? Welcome to the show.
Hi.
How you doing?
Hello.
You have a question for the doctors?
Yes, I do.
Go ahead.
Am I ready? I would like to know, being a diabetic too, what is better, butter or margarine?
Neither.
Go ahead. What you say?
Neither.
He said neither.
Olive
Neither.
oil.
Okay.
Oh, for real?
Extra
Yeah.
virgin
The other
olive
question
oil.
is, just for FYI, if you're taking metformin and you don't have the money, I would just like to inform them that ShopRite will give it to you free of charge as long as you do have a prescription. Thank you.
Thank you. And that's a very important information, because metformin is probably the first medication we'll reach out for people who have diabetes. And it's very important medicine, and the fact that ShopRite is giving it for free is huge.
Yeah. You know, I always like this show, and I don't know when people see me, they ask for the doctors, because it's very important information, because people have ailments, and we have an older population a lot of times who watch this show, and plus we're getting around the holidays, and you're talking about eating patterns, and I think we as a people have a tendency, we like fried foods, we like pretty much everything that's thick, you know what I mean? And some of that stuff is not good for some of our folks, right?
No,
Pretty much.
it's especially with the holiday, there are many ways to avoid getting in trouble around the holidays. One of the things, Thanksgiving is a great holiday and we all indulge, but I think the important thing is just to make sure that you limit your portions. I will encourage people to serve smaller plates. Limit your portions. Try to drink a lot of water before you eat. That also limit the amount that you consume.
What about drink a lot of wine?
It's not a good idea to drink a lot of wine with Thanksgiving dinner.
Now you tell me.
But the idea is, if you can taste a little bit of everything, but you shouldn't sit down and stuff yourself with everything. And then, of course, there's going to be a lot of leftovers. I think people should make sure that they pack those leftovers and refrigerate it immediately. That way there's no pressure to consume everything all in one sitting.
Doc, it seems like one thing connects to another, connects to another, connects to another in our communities. It's like just keep escalating. And then that's why I asked you about the pills. Then before you know it, you're on 45 different pills. Then you need a pill to control that pill. Am I right? Am I over exaggerating?
Yes, a little bit. I think that.
Yeah, right. How you doing? Welcome to the show.
This is Norman.
Yep, yes it is.
Yeah, how you doing, doctor?
Fine, thank you.
I go to a doctor every 4 months for a blood test to check my cholesterol. The last 2 tests have came back with extremely elevated random urine microalbumin test in the range of 205 and again in 215, and normal range is 0 to 17. Can you give me an idea of maybe what that is an indication of?
Yes, when you have microalbumin, basically what it means is that there's a lot of stress on the kidneys, either from diabetes, hypertension, other medical conditions that is related to the kidney itself. So what I will advise that you do is, if you do not have diabetes and if you don't have hypertension, you really need to have a conversation with your physician to find out exactly what is causing that stress on your kidneys for it to be leaking so much protein. In a situation where somebody is diabetic, one of the things that we typically do is that once we check for microalbumin, and if it's present, we will go ahead and put the patient on a medicine called an ACE inhibitor. And that medicine originally was designed to be a blood pressure medicine, but we use it to protect the kidneys.
That answer your question?
Yeah.
All right, thank you for calling.
All right.
Talking medicine. How you doing? Welcome to the show.
Hi, this is the person that was talking about the fibromyalgia again. Do you believe in narcotics treatment for this disease?
No.
He said no.
Okay. I've been on them for
The gabapentin that you're on is a great medicine for it. We also employ medications like amitriptyline, Savella. I think Pristic is also indicated. But narcotics is a bad idea.
How you doing? Welcome to the show.
Yes, hi, good evening. How you doing? Can I ask the doctor a question? Y'all asked me about, my son has, about gout.
You might want to turn your TV down so we can hear your question.
Okay, hold on, okay. Yes, could you ask the doctor, can you tell me anything? My son has gout. Can you tell me anything about gout?
His son has gout. Go ahead.
Okay.
Yes.
Gout basically is a deposit of a crystal called uric acid in the joints.
Beg your pardon?
It's a deposit of a crystal called uric acid in the joints. So usually when the uric acid level is elevated, it deposits in the joints, and for some reason it's got a predilection for the great toe, and the joint gets very inflamed and very painful. Now the idea is to reduce the amount of uric acid in the serum and ultimately in the joint. One of the things we do is first we need to stop the inflammation. So we give you something like indomethacin to reduce the inflammation, or prednisone to help with inflammation. And then there are medications like Cox that we also give for inflammation. Once all the inflammation is calm, then there are medication that we give you to stop production of uric acid, such as allopurinol. But because we don't know what is causing your gout, there are many things that can cause gout. Some medicine can cause it, lifestyle can also cause it, a lot of shellfish, wine. So because we don't know your history, my advice is for you to give your physician a call, tell them what's going on, have them review your history, examine you, and come up with a plan for you.
Okay. Thank you for calling.
Thank you. You have a good evening, okay?
You too.
Yeah, I'm surprised I don't have gout.
Probably do.
Fish and wine?
Shellfish.
Shellfish. You know, and sometimes it's bad having doctors on because you guys like cut everything out. I mean, what should I eat, like bread and water? How you doing? Welcome to the show. Look, he's great. Say, yeah. Let me stop you right there. How you doing? Welcome to the show.
Hey, Norm, it's Nino. This is Keith.
Hey, Keith. How you doing, buddy?
As a doctor, I have a question. I have a friend right now that's in the wilderness, and he's doing with schizophrenia, and the medicine he's taking, well, he's not taking it, and now he's out there somewhere in the world, I don't know, and everybody looking for him. I want to know what medicine and injections that he's taking for schizophrenia that cost so much, like $200. I don't know, but I'm just asking you, MD, the doctor right there is on your show. What should we do as far as trying to find him? Because I know everybody looking for him, and the medicine, the injection he takes for schizophrenia, and it costs so much, and Medicaid don't pay for it. What should we do? What should we do, sir?
I'm going to hang up so I can answer. Okay.
Schizophrenia is a very serious mental health condition, and those who suffer from it really do suffer. I know that in the state of Delaware, there's a lot of help for people who have schizophrenia because most of them are disabled, and most of them typically will qualify for Medicaid, and Medicaid does cover different types of medicine. I think what I will try to do is talk to his psychiatrist and figure out if there are other options beside the injection that he's getting, because on Medicaid drug plans, there's always a substitute available, and it's just a matter of working with the psychiatrist. As a family member, you need to be very proactive and be an advocate for the patient. A lot of times, he may not be able to communicate some of these things to the psychiatrist. You may have to, as a friend, also call the psychiatrist and let them know what's going on. As far as looking for him, you probably should get the police involved.
How you doing? Welcome to the show.
Hi, Norman. How you doing? This is Beverly calling. I was calling because my husband, he's a diabetic, and I changed my diet as well. I'm not a diabetic, but he is. And we do use the virgin olive oil. So would that, help me, stay free from getting diabetes?
Yes, as you get older, the amount of insulin that you make is less, and the type of action that the insulin does is less. And also, as you get older, you have more body fat, which may also lead to insulin resistance. So everything that you can do to prevent diabetes, you should do. Very good that you exercise, you continue to do that. The way you shop and cook and prepare your meals is also important. And the use of extra virgin olive oil is considered very healthy.
Okay. That answer your
All right,
question?
thank you.
No problem. Wow, we rocking and rolling. You want to say hi to Julius?
Hello.
Hi, Julius. He takes over my shoulder once in a while.
Yes.
How you know Julius? I'm joking. How you doing? Welcome to the show. You know he's gonna kill me.
I was wondering if the doctor could explain how important the A1C test is, and exactly what it is, and also how to take your insulin if you take your sugar and it is 40. Explain to someone how they should take their insulin in reference to that, so that they won't bottom out. And as opposed to them taking it when it's higher.
That sounds like a lot.
Yeah.
Thanks for your question. The A1C.
Okay, I'm gonna let you hang up and listen to the answer. Okay.
Thank you.
The A1C stands for glycosylated hemoglobin. Basically, what happens is blood sugar sticks to the red blood cells, and it takes about 90 days for those red blood cells to be destroyed. So when you check, the higher your sugar, the higher the number of the sticking, which means the higher the number of your hemoglobin A1C. So it's a great way of telling you what the patient has been doing for the past 3 to 6 months. If I checked your spot blood sugar, if you are eating a lot of candy before you come into my office, your blood sugar may be high. But if you are really, really good before you came to my office, your blood sugar may be low. So it's very deceptive. But if I checked your hemoglobin A1C, there's no way for you to manipulate that. So that tells the whole story of your lifestyle for the 3 months. It happens to be a great test, and I usually do it every 3 months on my diabetics. And the number you look for is 6.5. If it's less than 6.5, typically that's a good number. Anything above that means that you are in poor control, and some of those management strategies needs to be refined. Now, as far as insulin, don't know what kind of insulin you are on, whether it's basal insulin, basal bolus, whether it's Lantus, Levemir, Novolog. But the truth of the matter is, if your blood sugar is 40, you should not be taking insulin. What I will do is, I will check it, and I will make sure I'm in a safe place. I'll make sure there are people around me. I'll take some orange juice to bring it up to at least 60. Call my doctor and let him know that you bottom down to that level. That means there are some adjustments that needs to be made.
You know, when we're talking about sickle cell, right? Like I said, I remember we used to have the events at the hospital at the DuPont Hospital and stuff. I think that what used to trouble me is the young folks. Seeing kids as young as like 5, 6 years old, in that kind of pain, and parents have to rush them to the hospital. And then just hearing, that's why I was asking you, that's why I was surprised that now they live so much longer, because I was always under the impression that a lot of people pass away younger from sickle cell, but it sounds that now it's different medications and other things going on that's preventing.
Yes. With, like I was saying, prevention is very important when they're young, to take their
Hold on for 1 second, go ahead.
their amoxicillin and getting their pneumovax and other vaccines to help prevent complications from fever and infections is what a lot of children under the age of 5 passed away from sickle cell, but that has changed now.
That's horrible.
Yeah.
That's horrible. And I also, what I found when I was involved with it, just the education, people not educated about it, and so they didn't know where to go. And so I'm glad you're talking about it. How you doing? Welcome to the show. Hello? 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 It's off the work we go.
Yeah, and I think just like Nina said, I think education is key. We tell our patients, make sure you drink plenty of fluids.
Hello?
Make sure you get your
Turn your
flu
TV down a little
vaccine.
bit, because we're having a conversation.
I'm sorry. Good evening to the doctor and to the nurse practitioner. I have one comment and 2 questions. Why is tap water better than bottled water? Is my question. And do you incorporate homeopathic medicine into your traditional care with the patients? And I have a good friend who has lupus. Could you talk about lupus? Is it hereditary? And what is the treatment? And thank you.
Thank you.
That's 3 questions. I'll take the tap water question. The reason why I feel tap water is better than bottled water is actually there was a study that was done, looked at the bottled water, and you found out there's more bacteria, impurities, sediments in the bottled water compared to your regular tap water. And people
So I can save money.
Exactly, and people get this idea that because this bottled water is better. Really, truth of the matter is, in Delaware, it's definitely not. Our tap water is a lot better than most of the bottled water.
And I just want to say another thing is that you could put your tap water through a filter as well, like a Brita filter, and it's cheaper than buying bottled water, and it will distill some of those impurities.
Right.
Wow. Watch this show, you'll learn something.
But the main reason is that there are a lot of impurities, and the bacteria content in bottled water is way more.
Hold up and turn your TV down, because he's answering the questions. Oh my God.
She had a question about bottled water,
and lupus?
Lupus, and something else.
Well, let's take the lupus.
Okay, the lupus, systemic lupus is a connective tissue disorder, very complicated disease. If there's any suspicion that you have it, it's a multi-system disease. It can affect the skin, it can affect your kidneys. So if there's any suspicion that you may have it, I think what you need to do is find a physician who has experience with lupus, discuss it with them, let them examine you. It is not hereditary as far as I know.
Okay. How you doing? Welcome to the show.
Yes. Doctors, I'm a diabetic, and I just recently had some blood work done, and my creatinine levels were at question. What exactly is creatinine?
Okay, creatinine, usually when somebody is diabetic, there's a certain number of blood works that we do every 3 months. One is called the bump, which checks your blood sugar, your BUN, and your creatinine. And creatinine and BUN combined is a function of how well your kidney is working. And if your creatinine is elevated, that means the kidney is not working as it should. So it depends on the number. And if you are getting it checked, your physician will be looking at it and keeping an eye on it, and also based on your medical condition, whether it's diabetes, hypertension, or anything else, they will tell you what needs to be done and what the next step is. But most importantly, what are the things that you need to do to prevent your creatinine from going up? But going up is not a good thing.
Okay, that answers your question?
Yeah, what's a good number for a good level?
Usually less than 1.0 is good.
Okay.
For creatinine.
Thank you so much.
You're welcome. How you doing? Welcome to the show.
Hi, Norman. It's me again. I have a question regarding prednisone. I have a family history of chronic bronchitis, and whenever I get these episodes, I go on the prednisone, and sometimes it's on large dosages, as well as being a diabetic makes my diabetic numbers go really high. Is there another type of steroid that we could take besides the prednisone to remove that inflammation?
Yes. For chronic bronchitis, one thing is you really need a pulmonary physician to make a decision on exactly what your diagnosis is. But prednisone, I don't like at all. I prefer that you use something called an inhaled corticosteroid, such as Flovent, Pulmicort, and things like that. And those are delivered directly to the lungs.
Wow. I should have brought my dictionary with me. How you doing? Welcome to the show.
Hey, how you doing, Brother Norman? I would say we should commend Dr. Sioki and Dr. Nina for the endeavor they take on to sickle cell. My wife and I, when she had sickle cell, had to take her to Philadelphia to see doctors up there. But they took us an endeavor, man, and I really want to commend them for what they're doing, especially Nina for the hard work into it. And also, I like to say, the story I once heard, told me about a little girl was ashamed to say she had sickle cell at Delaware State College. And a lot of people came out there. But I'd like to commend you, Nina, and Dr. Yoki, for what you're doing.
Thank you.
Thanks.
Yeah, and that's what I think that's what I was alluding to. And again, I mean, like we were doing the Christmas events, and I mean, some of that stuff is really touching because a lot of diseases, a lot of stuff, when you talk about sickle cell and diabetes and heart condition and eye condition, it seems like the black community in particular, we have the highest rate in a lot of this stuff, And I guess my concern was, and I brought that up, and I don't know if I've got an answer, when you start getting on so many different pills, and I know it's not addictive, but it just seems unnatural to take, like you rifled off like 5 pills like that. I mean, just think that people got to take them in the morning. You get on like 10, 15 pills, and you're not a drug addict?
Well, but they say there's an easy way out, and the easy way out is for you not to smoke.
You talk about smoking a lot.
Yes, I am.
What about marijuana? Another subject. How you doing? Welcome to the show.
Hi. My daughter suffers from a lot of pain in her knees. And both her knees.
Yeah, if you turn your TV down, that'd be better because it's an echo.
Okay, let me turn it down some more.
Here, see?
Okay, it's hard to get this thing to go
That's
down.
okay, go ahead.
Okay, she eats a lot of crabs, and I was wondering if that might have an effect on her because she had fluid on her knees from time to time. They found.
And
the crab might have some ingredients that work against her that causes pain in her knees. It's very unbearable pain she has in her knees.
Is that true?
Yes.
All right, thank you for the call.
One of the things, crab is shellfish, and those who eat a lot of crabs tend to have gout, and uric acid can deposit in the knees. So I don't know how old that daughter is, but certainly,
so all that works hand in hand.
All works hand in hand. So certainly they need to call their physician, let them know the history that and it's a simple test. You can check the uric acid level, and sometimes if the knees are swollen, you can actually put a little needle in it and draw out some fluids and look under the microscope, and you can see the crystals.
Wow. What can you eat? How you doing? Welcome to the show.
Yes, I'm calling back again. The question that I had asked that the doctor couldn't remember, and it's kind of piggybacking off of the question that you just asked, is that do you incorporate homeopathic medicines into the traditional medicines that are given to the patients?
Thank you very much.
Well, homeopathic, to me, it's wholesome medicine. That's what I call it in my practice. And what is wholesome medicine? Wholesome medicine basically means that you look at individual patients and you make a decision what's best for them in terms of lifestyle. And what is lifestyle? The things you do, the things you drink, and the things you eat. Then you look at medication. Medication in our practice is always the last resort. There are situations where there's no doubt about it, you have to be on medicine. But in addition to the medicine, we always give you instructions in terms of, lifestyle modification, exercise, and things like that.
And I just want to say for my patients with sickle cell, I do like to use homeopathic adjuvant therapy to try to use less pain medication. So deep tissue massage is very effective in reducing sickle cell pain crisis, as well as acupuncture. For some patients, it works very well for them. So
that seems painful, acupuncture.
It's
Those
not
needles.
Really. It's just a small pinch.
I kind of halfway joking about it, but we are legalizing marijuana. So is that good for glaucoma? I mean, do you subscribe to that, or do you think or is that a little bit too deep getting into? I mean, at some point, I guess you will, as physicians, like if they legalize it and someone comes to your office, you're gonna have to say, yeah, this guy.
There are some people that believe that marijuana will reduce the pressure, but I believe that there are other medicines, other eye drops that are more effective.
So that means I can't come to you for any weed?
No.
Okay. So you got a joint on you?
No.
Okay. How you doing? Welcome to the show.
Yes, I have a question I wanted to ask the doctor.
Okay, go ahead.
Okay. My daughter has lupus. She has a small patch of it behind her ear. And she's been tested for it. And I wanted to know how serious it was and what could be done to prevent it from spreading.
Okay, thank you for the call. You hang up so you can listen.
Yeah, we talked about this earlier. Lupus is a connective tissue disorder. It's a systemic disease. It not only affects the skin, it affects other organs in the body, specifically the kidneys. It is serious, and what I will suggest is that you call your daughter's physician or have her call them. Make sure that she's being followed up by somebody who has experience in treating patients with lupus.
Okay. How you doing? Welcome to the show.
Yeah, terrible evening to you there, Nora.
How you doing?
I'd like to thank Nina for the work she's been doing for the sickle cell. And I don't know the doctor yet, but I'm Jimmy's father. How you doing, Nina?
Hi, how are you?
Okay. Nice show tonight.
Thank you.
Good job.
Yeah, thank you for the call. So I guess you've pretty much worked with some of these patients.
I don't think Nina will say this, but as you know, she has a PhD, and there is a void. Most of the young children that have sickle cell, they have a robust and comprehensive program at AI where they get a lot of services. But once they become adults, there's a void there. And what Nina is trying to do is fill that void, try to provide those type of services to the adult population also. That way they're in a more comprehensive place and dealing with somebody who knows a lot about sickle cell.
Okay, you want to talk about that? So at a certain age, a certain point, they don't get as much care. Is that pretty much it?
Yeah, the resources are just not there once they leave out of a pediatric or a children's hospital.
I didn't know that.
And unfortunately, a lot of times the care becomes more fragmented, and as you get older with your sickle cell, you can develop more complications. For example, sickle cell patients can have problems with their kidneys, just like diabetics. They can lose their eyesight if they get a crisis in their eyes. They can have problems with their joints. They can develop pulmonary hypertension, which is high blood pressure in the lungs that affects the heart. So it becomes very complex to manage, and as well as a lot of patients have pain. I mean, they live with chronic pain. And so it becomes very complex, and it's not difficult to manage, it just takes more time and resources to do that.
Okay. Oh, thank you. That was good information. Thank you very much. How you doing? Welcome to the show.
Okay, this is Jean Jackson calling back again. I'm calling on behalf of my daughter, the one has a lot of pain in her knee.
Hey, Jane, we can't hear you. Your TV's up too loud.
I know, I can't get the remote won't work.
Don't worry about it. Hit it. Break your TV.
Okay,
See, we can't hear you. Call back when you get your remote together, because we can't hear you. right? I mean, I think she was talking about her daughter with the knees, but we can't hear it. Am I right? I mean, it's an echo in here. We can't hear you. How you doing? Welcome to the show.
I have a question. If you're a diabetic and you have high blood pressure and you have heart problems, is it really necessary to take the flu shot or the pneumonia shot?
Good question.
Yes.
Thank you.
It's very necessary for you to take the flu shot, and if you meet the criteria, you should also consider taking the pneumonia shot. But if you have all of those medical conditions, diabetes, heart problems, and things like that, you really need to have a very good relationship with your physician. And that leads to another topic. This year we've been lucky with the flu season and the flu shots. There are 4 different types this year. For the first time, we have one that is egg free, so those who are allergic to eggs can certainly get this flu vaccine without any problem. Then, of course, we have the flu mist, which is a live virus, which is recommended for younger children. And finally, we have the double dose, which is recommended for more older people.
Double dose?
It's a double dose, yes. And then, of course, we have the single dose. So there are 4 options, and that's the reason for that is there's no reason now for anybody to say that they don't want to get the flu shot. And the flu vaccine does not give you the flu. You may have a little bit of a reaction to it. You may develop a fever, body aches, but it doesn't give you flu. Plus, if you are living with somebody who has some immune disorder, cancer, receiving chemotherapy, be sure to tell your physician about that because you may not want to get the live virus.
Okay, and don't forget, next Sunday, December 1st, annual community holiday dinner at Moya Academy. That's with Gundy Jacobs. I think Zinga's having something. Zinga erased. I don't know. I must have lost it. And Zinga, I know you have an event. I want to thank you, doctors. Thank y'all for coming on. Anything in closing? We had some phone calls, but we only got 2 minutes. We got to pay our commercial because I want the color folks out at the Church of Youth and Family. You know what happens? You get these people in church, right? They start falling over saying and Black Power, and they cut you. Man, they will cut you down. Well, I don't even want to go. I go to their church. I don't even want to go to some of the church. You go to church, you come out with one leg.
In closing, on a medical note,
I like hanging out with you too, by the way.
I think that the important thing is just like we've been saying all along. One is people should drink water. People should eat a healthy diet, specifically maybe a Mediterranean diet. Lots of veggies, lots of fruits, nuts, and extra virgin olive oil. Definitely you have to have a relationship with your physician. Definitely do not smoke.
And exercise.
And don't smoke anything and exercise.
And Kenny ever keeps telling me about exercising. I am back exercising. You can play my commercial, man. This for the color folks.